Um, Welcome everyone to another episode of the JPN podcast. I want to thank Rabbi Dr. Daniel Roth for joining us this evening. Rabbi Dr. Roth is a clinical professor of ophthalmology at Rutgers Robert Wood Johnson Medical School, the author of Halachos of Refuah and Shabbos, among other halacha medicine works. And tonight's shir is titled "A Not So Simple Habura: Wound Care on Shabbos." And Rabbi Dr. Roth is going to discuss various challenges that may arise in treating wounds and injuries on Shabbos and how to navigate them. So, Rabbi Roth, floor is yours.
Thank you so much. Good evening, everyone. So when dealing with wound care on Shabbos, and we'll discuss this from perspective of someone who is working in the hospital and having to deal with wounds that come in and take care of them and dressing them and cleaning them and suturing them, from the perspective of a physician who may be at their house and someone's coming over to ask you questions, which often happens to us in the course of our careers, or just someone who's interested to learn more about the halachas and the applications. With regard to wound care, there are several malachas, several violations of Shabbos that are possible that we have to address. Sometimes they may be rabbinic, sometimes they may be deraisa, Torah prohibitions. One, again, we'll go through all of them. Possibilities would be tzaveh, coloring the cloth or the gauze with blood, nolad, which is creating a new entity, or makeh b'patish. And machik means like smearing, things like ointment or soap, and we'll talk about that. Schita means cleaning out a cloth of some sort, or squeezing. Teifer is the big one, which is sewing. Kosher, which is tying, that's another big one with knots. And chavala. So let's just start with the definition of different wounds. Some wounds have a low level of risk and have to be categorized as just a mechush. It's just an ailment, not really a din chole, not someone who's sick, that allows any violation of Shabbos, like superficial skin cuts and things like that. Full thickness skin is a deeper wound, and that would definitely be more considered something to address, and starts to have a risk of infection. Once it's deeper than the skin by more than 1/4 of an inch, it's a higher risk. Then there's a potential sakana, and clearly if it's deep into the body cavity, there's the risk of sakanas nefashos, of something that could lead to a life-threatening risk. Certain wounds, certain cuts are more risky than others, especially with regard to infection. If it's a dirtier wound, if it's an animal bite, and actually a human bite is even worse than an animal bite, and obviously if there's a risk of rabies, there's a risk of sakanas nefashos. And then there's the issue of closure of the wound. Why do we close the wound? Mainly to prevent infection, and also for cosmesis. We don't want to leave a big scar. Sometimes, nothing to do with the halacha, medicine dictates that we have to leave the wound open to close by secondary intention, because we're worried that if we sequester and close off a wound and put bacteria inside the wound, close it, it can lead to serious infection, especially if a dirty wound or a bite wound. But typically, when a cut comes in, even if it's dirty, we can irrigate it, we can sterilize it as best as possible, and close it. How long do we have? What's the golden rule? A wound comes in on Shabbos afternoon. Can I wait? Can't I wait? So studies have been done, and they show that there is a golden rule of almost 19 hours. That studies show that a wound, again, not a dirty wound, a regular cut, that is closed within 19 hours has similar outcomes with regard to infection and complications as wounds closed with less than that time. Once you're more than 19 hours, you have a problem. If you have a wound in the lips or the scalp, which are highly, highly vascularized, then you actually have even more time. Actually, this happened to me approximately 23, 24 years ago, when we had just moved to Lakewood, where we live, and I was after my fellowship, starting my practice. And my two sons were playing a game. The older one was going to direct the younger one, and the younger one was going to close his eyes. Well, unbeknownst to me, they were playing this game, and the younger one trips on a concrete step, and he gashes his forehead, and he's got a big bleeding wound. As we're walking on our way to someone's who was kind enough to invite us for Shabbos lunch, we quickly go back to the house. I clean off the wound. I put on a tegaderm that I happen to have in the house, and we said, "Let's go. We'll go to the Shabbos meal. We'll have our Shabbos afternoon regular daily routine." And then Motzei Shabbos, Saturday night, I took him to the hospital. They found a plastic surgeon, cleaned him up, sewed him up, and he looks great. He's since got married, no problem, no scars of concern. But let's talk about different things going step by step. So you have a superficial wound. It may be a mechush. What do you do? So there are you can put a bandage on it. You can clean it, obviously. You can stop the bleeding. These are not malach, they're not problems. You can obviously stop the bleeding, perfectly permissible. But there are poskim that say you should avoid using a cloth that colors like a white, a certain washcloth or a certain cloth material towel that you are coloring with blood when you do it. Others are not so concerned because the Eliyahu Rabbah is mekel because it's derech lichluch. It's a dirtying mechanism. You don't want to color that towel red, so therefore it's not a problem. But the Magen Avram is concerned about it, and it's better to avoid it. If not possible, you can. Typically today we use gauze, even we use tissues, whatever it might be. And obviously, if you use gauze, these are disposable items. They're not a problem of tzevea. There's no issue there. Washing the wound, not a problem. You could wash it off, but again, ideally trying to use something disposable that you clean the wound without squeezing it out, because if you have something that's non-disposable, and especially even disposable things, you don't try and squeeze it out, but since your intention is not to clean it, but rather you're using it to clean something else and then throwing it away, there's not a problem of schita, even if some liquid comes out of it. But using a cloth, you have to be more careful not to squeeze liquid out of the wet towel, and you can't really wet the towel directly. So the best way to wash the wound is to pour some liquid material on the wound. Obviously, you don't want to pour non-sterile water. If you have sterile water, you can pour that on the wound and irrigate it. Saline is ideally the best. You could rinse the wound with saline. Pouring a disinfectant like betadine or hydrogen peroxide is not considered a refuah, and even for a non-choila situation, even for a superficial wound, you're allowed to use it because it's a disinfectant. And the poskim write that antibiotics, which are used normally to heal, fall under the category of the Isser Shchika Samamanim, the prohibition of healing. Again, we're talking about a situation where it's not permissible. We'll get later to situations where it's a wound where there's no problem of healing because the patient is in the category of a chola, or even worse, a sakana, person who's either non-life-threatening or life-threatening. But assuming it's just an ailment, an irritation, something that bothers the patient, and you want to clean it off and get it all cleaned up and put a band-aid on it, so then there's no problem cleaning it, there's no problem putting disinfectant or betadine on it, but antibiotics are maybe more of an issue. The antibiotics heal, they actually also decrease the bacterial load, not only in terms of preventing infection, but they actually can reduce pain. So generally, it is a good idea to use some antibiotic ointment in order to reduce the bacterial infiltration that sometimes can cause discomfort. Bottom line is you can disinfect, and that's not a problem. Now, what about a deeper cut? If it's a deeper cut, then there's definitely either a risk of infection, can be very serious. It can get cellulitis, even if it's if they deeper cut, they can have a lot of pain from it. That may be have a category of a chole. And then you don't have a problem of doing rabbinic healing mechanisms like taking antibiotics orally is not a problem. Putting antibiotics on it is not a problem, except the problem of smearing it. So if you take antibiotic ointment and you smear it onto a wound, again, we're not talking about a deep wound, but a wound that is subject to or a closed wound. We'll get to how to close it very soon. But smearing it on is a discussion among the poskim. Most say that when you smear on a coating, a thick layer of ointment, Vaseline-based ointment, that would be a problem of the malacha memachek, of smoothing a new surface. So we try and avoid it. The best way is to put the ointment on a gauze and slap it onto the wound or wherever it is, instead of actually rubbing it in or smearing it. There are those that say that if it's a thin layer of ointment that you're rubbing into a wound and there's no real layer left behind, that does not qualify as memachek. But the general opinion is to avoid it if one can. Again, unless it's somebody where there's a risk of serious infection, then obviously you can do it with a shinui. But it's easy enough to put it on a gauze and slap it on, just like with baby diapers. Baby have diaper rash, so to actually smear on thick diaper rash material, not oil-based, but more of a thicker cream, like whatever it is, that may be a problem in of creating a new surface. The suggested approach is to put it on the diaper or put it on the baby's buttocks, and then it smears itself in when they wear their diaper. Put a copious amount, generous amount in the diaper, and then when they sit on it, when they move around, it gets where it needs to get. But with wounds, it's the same thing. If there is, if it's not, if there you want to avoid memachik, so you try and put it on not as a thick layer. What about bandages? So bandages, again, we're talking about minor wounds. You want to take a Band-Aid, you want to rip it open. Sometimes it's very hard to avoid letters. You want to try and avoid cutting between words as much as possible. Unless it's a really serious reason, ideally, usually you could get it open by being careful and trying to avoid the letters. If there's no way around it, you could do it better do it with a shinoi, with an indirect way, tear it open with your teeth. So, if there's no way to open it without tearing letters. But otherwise, ripping it open is not a problem, just like ripping open any disposable package is generally not a problem. Let's say you need a small piece of gauze and it's a bigger piece of gauze. You can't cut it to size because that's a problem, but you can fold it up, or you can just use the whole roll of the gauze, if it's a roll of gauze, and just roll it, even if it's big and bulky, and then tuck it in. This way you don't have the problem of cutting to size. If you do need to cut something, whether it's gauze or tape, it's best to do it in a way where it's not exact, because that's the problem. Mechatech is cutting something to a very specific and designated size. If you want to cut it, then just rip it randomly. These tapes sometimes have perforations like toilet paper, and they give you very specific sizes. It's better to avoid those, or even to cut them not at the perforations, but in between, in order to avoid the problem of mechatech. There is a discussion among the poskim about when now you want to close a superficial wound. We're not talking about sutures yet, and you want to close it. So to put a Band-Aid generally is considered not a problem. The Band-Aid is just covering it and keeping it clean. It is not bringing the wound edges together. What is the problem of bringing wound edges together? What's the malacha? Why is it bad? So there is a machlokas in the Rishonim. There's a dispute among early commentators whether binyan ba'adam, building in a person, is considered a deraisa. Rashi learns that there is binyan by balei chaim, with animals and humans. There is an isser of binyan. Bona is one of the malachas. The Rambam holds there's no binyan. By tfira, sewing, even though there's a discussion, it says vayiven asatzela, and maybe only by, in that case, building chava from the rib or from the side of Adam was considered building, but maybe there's no binyan ba'adam, and it's discussed in the Rishonim. But by sewing, there's a different discussion, and there's more of a leniency that sewing ba'adam may not be binyan, even though some Rishonim learn binyan, building a person or building an aspect of a person, would be. So let's say maybe putting in a new joint, like a hip replacement, maybe binyan ba'adam, but taifer, sewing, Rabbi Cheskel Abramsky, Rav David Cohen, and Rav Chaim Pinchas Scheinberg all were of the opinion that it's a rabbinic prohibition. Sewing a wound closed, and we'll get to the tying part of it, but the actual suturing is a derabanan, even if you pass multiple times. Tvira, which is a malach of sewing, would be 2 passes through, you're sewing 2 pieces of beged of cloth together or something like that. If you pass 1 stitch through it, that would not be tofer deraisa. 2 stitches would be. Clearly, if you're suturing wounds, you're going through one and the other end. It's a double pass, but it may not be a deraisa according to many poskim. Rosh Shlomo Zalman Auerbach and Rav Elyashiv Zatzal were concerned that they had a suffix about this, and they were concerned that it may be a real deraisa, a real Torah prohibition of suturing a wound. So this becomes very relevant when you're in the hospital. You're on call, or you're working as an intern, you're working as a physician, and you're working in the ER, and there's a patient that has a wound. So if it's a serious wound and there may be a risk of infection, so you can do a deraisa, because the deraisa is permitted to avoid serious infection. That's a questionable pikuach nefesh, and you can sew even if it is a deraisa. Obviously, we try and limit and minimize the malacha that we do. So if there's a way to do it in rabbinic fashion, we can. But here you can't suture with a shinui or an indirect fashion. You have to suture it properly. So you can rely on those that say it's derabanan, or if you have to, you can rely on those that say it's deraisa. However, when you're in a situation where you're taking care of Eina Yehudi, then it's really preferable, very, very seriously preferable, to avoid a deraisa whenever possible. So at least you have those opinions here for suturing a wound, even for an Eina Yehudi, that it is a Derabanan only. And, it's a different discussion about what you can, whether everything to what degree you function in the hospital or with patients that are Eina Yehudi the same as a Yehudi. We try and avoid doing Malacha D'Oraisa for Einim Yehudim, even if it's Pikuach Nefesh, and clearly if it's not, and especially if it's only a Safek Pikuach Nefesh, it really could wait. So you have the opinions to rely upon that suturing itself is only the Rabbanan. And this is really the basis of Rav David Cohen permitting people to do a residency for many people without it being strictly Shomer Shabbos. I mean, our topic tonight is not Shomer Shabbos residencies, but the Kabbalah that I had from many Gedolim and from others is that ideally you don't want to go into a situation where a priori beforehand that you're going to do Doraisas for Einam Yehudi. But many things in the hospital, especially today, can all be done as the Rabbanans. And if you know beforehand, even though you know beforehand, you're going to have to do the Rabbanans, it's much more justifiable to be in that situation, albeit not ideal, but not something that you have to give up the practice of medicine for. But obviously, if it's a real Isser of a Malacha D'Oraisa that's not justifiable with the halachas of Hilchas Shabbos, then it's hard to justify anything, even if it means a career in medicine. But since there are plenty of formidable poskim that say suturing is D'Rabbanan, and we'll see how tying knots may only be D'Rabbanan, therefore there is a justification to doing that. But the biggest problem is drawing blood, typing notes, using electronics. Again, you're always dealing, at least for regarding refuah, even though there's a Chazon Ish who holds that's a deraisa, you're dealing with a D'Rabbanan. Getting back to our topic, so tefira, sewing. You're sewing a wound. You have a deep wound. You clean it out with betadine. You rinse it out with saline. You get the wound clean. You have little particles in there that are foreign bodies. You're allowed to take tweezers and pick them out. It's not borer because it's not a mixture. You're allowed to get rid of the pieces that are in the wound that are problematic. And now you want to suture it. And you take your whatever suture you think is the right one, whether it's a 6/0 nylon or whatever you believe is the right suture for this size wound, and you start sewing. So you sew it, and now you want to make a knot. So you can make your knots. Is that kshira? Is that tying an issa deraisa? So we know that if a knot is there for less than 24 hours, then it's not a deraisa. But you're never suturing a knot in a wound in a patient and taking it out within 24 hours. Sometimes they're 5 days, 7 days, up to 2 weeks or longer if it's on the extremities. It's there for a significant amount of time. So some say it's kayama because it's there for 24 hours, and that makes it a deraisa. And that is a serious consideration. However, there are those that say that since the knot is not permanent and it will be removed, and it was never intended to be there long term, it's still not a deraisa. Prohibited is a derabanan, but not necessarily is a deraisa. So there's definitely room to be choshesh for a deraisa on the sewing and on the tying, but just kind of in the back pocket heter, there are opinions to rely on when necessary, but it's definitely not ideal to rely on considering suturing and tying knots as a derabanan. There are those opinions, as I'm saying, just to kind of be able to be melamed schus, but there are formidable poskim like Shlomo Zalman and Rav Elyashiv who hold that sewing is a deraisa, and also there are those that like Rav Elyashiv holds that tying the knots is also deraisa. Because what happens is you're not undoing the knot, you're not untying the knot, you're cutting the suture in 7 days or whatever it is, and you're just taking it out of the skin and throwing it away. The knot stays a knot. You're not untying it. So since it's never made to be untied, you're just cutting one end of the suture and throwing away the knot and the suture. According to Rav Elyashiv, that is considered a deraisa of shira because it's permanent. And Rosh Zalman holds that that's not considered a deraisa. So at least, again, you have Rosh Zalman in a case of need, but whenever possible, you want to avoid that. So now let's say we're talking about a regular situation of a Jewish patient, they're coming to you and they have a wound and the wound is deep. So if you have a number of hours, it's Shabbos day, and there are a number of hours till Saturday night, you really, ideally, it's best to wait till Motzei Shabbos, because unless there's some reason why it won't be able to get done Motzei Shabbos, it's typical that if you call, they go to the ER, or if they don't want to, if you want a plastic surgeon, so to speak, so they say clean it, put on betadine, antibiotics, cover the wound. I'll see them in the morning. I'll suture it in the morning, and that's commonly done, and that's acceptable medical practice because you're really preventing an infection and addressing it within a certain number of hours. It's accepted medical practice. The question arises that if we didn't have antibiotics and we didn't have certain things today, that wound, as it presents itself, has a pikuach nefesh risk. So do I look at it now as a wound with pikuach nefesh risk? And I don't entertain the other elements that, since I have other aspects of betadine and cleansing and antibiotic ointment that can hold it off for a while and prevent a problem, then it takes away its pikuach nefesh status, because that's an intervention. Right now, it's a pikuach nefesh. If it's a pikuach nefesh, I can do it definitively. Or do I say, no, since now I can prevent the pikuach nefesh with a non-malacha, i.e. cleaning it, sterilizing with betadine, and putting on antibiotics and covering it, then that's what I should do, and then address the wound, 2 hours later, whatever it is. Most poskim rule that one should delay it because now it's not technically a pikuach nefesh. There are, and including Shmuel Kamenetsky told me, that one can treat it. It comes to you, it's a deep wound, it has a risk. I'm not talking about, wounds like penetrating into the abdominal cavity or something like that, where clearly you want to address it immediately. There, you need to open it up, explore, make sure. I'm just talking about it generally deeper than superficial skin. And it is a sakana of cellulitis or deeper tissue infection that can spread, and this or whatever it might be, especially in compromised patients. So if that's the case, even though you can clearly wait, there's this golden rule of suturing that you can wait 2 hours, wait even up to 19 hours. Since it presents itself as a pikuach nefesh, you're allowed to suture the wound and close it definitively on Shabbos in order to prevent the pikuach nefesh risk, and that would be considered a justified pikuach nefesh doicha Shabbos situation, and we'd be allowed to do so. What about if you don't? And you can close it up and keep the edges, albeit not so. They may be a little ragged, they may be a little gape, little small spots. It'll close it enough so the tissue edges are together, and it will prevent infection and do everything you need for the pikuach nefesh risk. But it won't look so nice. 5 sutures will do the trick of that, but you really need 8 sutures to make it really nice and smooth all along the wound edges. So there's a discussion in the poskim about this. Rav Zilberstein, who's a tremendous, mumcha in medical and has many shurim. He has a fascinating discussion where he writes that just like when a moil is doing a circumcision, and he is allowed to continue to cut all the tissue around the aver, or while he's doing the circumcision, he's allowed to take off all tzitzim, even she'ena ma'akfim. He cut off all the parts that are necessary. There's still some tissue there that doesn't look nice, but it's not ma'akiv. It's not going to make the bris milah invalid. Once he's involved in the tzitzim, even if they're not ma'akiv, once he steps aside and stops, he's no longer allowed to go back and remove tzitzim she'ena ma'akfim samila. They don't prevent. So he wants to make an analogy here. Once you're actively suturing the wound and involved in the care of that wound, you can put in the stitches in order, one after the other, to make it look appropriate and clean and nice and cosmetically appropriate in order to finish the wound properly. And even if it only needs 5 stitches to prevent, one can go in order and do 8 stitches in order to make it look nice. If you put in the first 5 and then you look back and you think you probably need another 3 to make it look nice, not so simple. But if you just go in order from the beginning to end and go one after the other, then it would be justifiable. And you can even do the extra stitches, even though the extra ones are more for cosmesis than they are for infection perfection. Let's say, there's a wound on the face, or there's a wound somewhere where it's going to cause a cosmetic problem. And, for infection control, you may not need to do it right now. But for cosmetic reasons, whether there's a plastic surgeon available now but won't be available on Motzei Shabbos, or whatever reason it is, and you really want to be able to, make it look nice, can one justify having a non-Jew, Jewish surgeon or non-Jewish physician suture the wounds nicely in order for cosmetic purposes alone? And there are posts going to discuss this. So what would be the justifications for cosmetic purposes? It's not for pikuach nefesh. It's not for any major wound infection control. So argument that's just I found always very fascinating. That there's a concept that you are allowed to have a goy do suturing for a sakana saver for sure. And since the face is supposed to look, it's how you look towards people that's the purpose of the face as an aver. I mean, obviously it has many functions, but the aver of the face is to look appropriate. And if there's a scar on the face, it doesn't look nice. There's a chasarn of the function. When you have a sakanas aver, it doesn't mean that you lose all control. If a person has vision loss, even if it's not significant vision loss, some vision loss, that's a sakanas aver. May even be more than that. If someone has some loss of their wrist or their finger, even though they can still use it, but it's not as functional, then that would be sakanas aver. And sakanas aver justifies a Jew doing even a malacha d'Rabbanan directly, and a non-Jew doing anything, even a Torah prohibition. So therefore, for the purpose of sakanas aver, for keeping the face looks nice, one can have a non-Jewish surgeon or physician close up the wound on the face for the sakanas aver. There's also a permissibility to have a non-Jew do something with kavod habrios. It's a rabbanan. Asking the non-Jew to do the work on Shabbos is the rabbanan, but it's for kavod habrios, for the honor of the human being, that he should feel comfortable about himself. That would be a justification for kavod habrios to have it done that way. And similarly, there's a permissibility to ask a non-Jew to do a malacha, even if that may not be a mitzvah, but for a great loss. If something comes all of a sudden, hefsid gadol habab pisaim, it comes all of a sudden. Salman writes about this, and he says it's permissible to ask the non-Jew to do it because it's a hefsid gadol that comes all of a sudden, and for that purpose, for that reason, one would be allowed to do that. So, in summary, if one is presented with a wound on a Friday night and there's a high risk for infection, then one is allowed to do even the deraisa to prevent infection, especially if there's a concern that regular means to hold off may not function adequately for infection control. Obviously, since it's not an emergency of minutes, you try not to drive yourself, take an Uber, go to the hospital, see if you can get an Yehudi to do it, someone who's not Jewish if possible, because of the deraisa malachas. But if necessary, a Jewish physician can suture the wound, especially if it's a Friday night and there are many hours till Shabbos is over. If it's Shabbos day and one can really wait till Saturday night, it's hard to justify to do a deraisa. One can argue that maybe you can rely on the opinions that sewing a wound and tying the knots is a rabbanan. However, many opinions are of that opinion that may be a chash deraisa. It's a Torah prohibition, and therefore it's best to avoid it and best to kind of pass it on to the non-Jewish resident or somebody else, and avoiding doing it yourself. If there are any questions at this point, we'll kind of take a short break and see if anybody has any questions on the topic.
I'll ask a question, Dr. Roth. I don't think you covered, what about infiltrating with lidocaine the wound for local anesthetic?
Right. So infiltrating with lidocaine is a great question. It's not a problem of a deraisa for sure, even if it will cause bleeding, because you do not want that bleeding. And the injecting into skin or into a wound is not considered, definitely not a derabanan, and maybe even not. I mean, not a deraisa, may not even be a derabanan, because the blood that comes out is not even. It may not even. It's not 100%, and even if it is more or less 100%, it's leinichale. So it would be in most of the derabanan. And for the sake of a wound that needs lidocaine to suture it, one would be allowed to do that. Again, it would be in most of the derabanan.
Yeah. Another question is also, is there any difference for a katan? Because I know the Ramah mentions for a katan, we treat a lot of issues as a solution.
So again, getting back to lidocaine, I mean, it is possible sometimes for kids, we don't inject them because they're so afraid of needles. We use lidocaine gel, and one can do that depending on the nature of the wound. A katan, again, the katan status is that for anything that they have, any ailment or any illness, they automatically become a choyle she'ein by sakana. So that bumps them from ailment to choyle she'ein by sakana, which would justify doing a rabbinic prohibition with a shinoi. Now, there are opinions that say that when you can't do with a shinoi, you can do without a shinoi, and one can rely on that in a case of need. Also, the definition of a katan is questionable. Some say it's only up till like 3 years old. Some say it goes even up to 9 years old, but definitely doesn't seem to go up to 12 or 13 years old. So a katan really, for this concept where they get bumped up from a regular status of a mechush to choyle she'ein by sakana automatically for any cut, ailment, or wound, that would be probably up till age 9. However, most of these cuts, especially if you're suturing them, they anyway have a risk of infection. But it's a good question you're raising, because let's say you're not really worried about infection. It's not so long. You have a number of hours. You can easily address it. Motzei Shabbos and katan. Does that change the playing field? Because now they're a choyle as opposed to a mechush. So if there's no risk for infection, what makes them? They just have a cut. So if there's a lot of pain, then and often, if you have an open wound, it hurts, and that if it's a lot of pain and they're very distressed by it, that would probably get anybody into a category of a choyle. For a katan, for sure, they would be automatically in the status of a choyle, even if it's a small cut. For sure, a cut that needs to be sutured, even if it can be, even if you can wait. But it would only justify the katan going to choyle status. Would only justify doing a derabanan, or asking a guy to do it, or doing derabanan with a shinoi. Hard to suture as a shinoi. And again, if you don't really have to, we don't rely on doing it without a shinoi if it can wait till Saturday night. So it doesn't really give you a lot of room for leniency. Good questions. Let's talk about some other things that are commonly used in taking care of wounds. Relatively superficial wounds, even surgical wounds, especially if there's a deep layer of suturing. The superficial layer, if it's a superficial cut, can be closed with steri-strips. In the olden days, it was to be butterfly, so the postum talk about a parpar or a butterfly suture. So we're not talking about a Band-Aid, we're talking about actually bringing the wound edges together with a steri-strip. Is that the same as suturing, or is that the same as a Band-Aid? A Band-Aid is fine. Suturing is problematic, as we talked about. So some want to argue that since you're bringing the wound edges together and you're holding it together with the steri-strips, that's like suturing. And that may be a chashash of deraisa. And that's Rav Elyashi's position. Others say that you're just holding it, but the edges of the wound are not sewn together. You're just bringing them to touch. But the actual closures are being performed by the coagulation and the healing process of wound formation and scar formation within the wound by the body. And you're not doing anything of the sort of actually suturing or bringing the wound, making the wound a closure. Therefore, it would be permissible to do it. There's a back and forth, a discussion of Shlomo Zalman. He says ideally one should not do it if one can wait. But in a makom tzarich, in a case of need, it's clearly better than suturing. And often what one can, in many wounds that are not too deep, you can bring the edges together. You can even put some sticky material on the skin that makes the steri-strip stick very well. And steri-strips can often keep a wound closed. If it's only, albeit if it's temporarily, if someone comes to your house and you don't have to necessarily go and bring them into the back room and suture it, if you have that setup, you can steri-strip it and then address a real definitive suture Motzei Shabbos if you want. That definitely works. So that's a kind of a important thing to do. But Rav Elyashiv is still concerned that steri-strips may have a din d'oraisa of similar to suturing. What about glue? So glue, Rav Shlomo Zalman permits. Aerosol bandage, or like a spray bandage that is a liquid or spray that then hardens into a coagulum on top of the skin and basically changes it from a liquid to a solid. maybe a problem of Ola, a problem of Makabapatish. It's discussed in the poskim. Again, there's a dispute whether that's considered a problem. It seems like Shlomo Zalman is not worried about it, but other poskim are concerned that that may be a problem of Nolad or Makabapatish. So if one can avoid using, it's better to use a Band-Aid than using a liquid bandage on Shabbos, even though some people like to do that these days. It's better to avoid that in that situation. What else can we talk about? So we talked about suturing the wounds. We talked about the knots. And again, the knot is an issue because you're leaving it there and you're not undoing that knot. And again, there are those that permit it, but the problem is that it's not a knot that's ever going to be undone. So there are many poskim, some poskim see that as a kesher shakayama. But again, you always have in your back pocket the concept that you can, in a case of need, to rely on the fact that sewing is the rabbanon because it's beguf adam. It's not in sewing cloth. Rav Shlomo Zalman is of the opinion that sewing is a problem, maybe a deraisa, because he compares it to this. Clearly, we know gluing papers together is an isser of a deraisa because it's similar to, when you glue papers together, there's a makar for that, that's considered a problem of tefira, and so too maybe suturing may be similar to that, and therefore he's concerned about the deraisa of suturing, just like gluing. Gluing on top of a wound, though, is not where you're gluing the edges together. You're just putting a layer of glue on top, and the wound edges are just being held together. Talking about this concept of gluing or of tofer, you used to be that well, let's take a regular Band-Aid, and we'll go back to simple wounds. If you have a Band-Aid, so to open the Band-Aid, you have to open the package. Not a problem. Try and avoid ripping the letters. Now you have these sticky tabs on the edge of the Band-Aid, and you peel them off. Well, they were there for a long time, and now it's like a kshira. It's like an attachment, a glued attachment on the sticky part to the white little tab of the Band-Aid, and removing, according to the Minchas Yitzchak, is a problem of matir. It's a problem of like kosher matir. It's like removing it, and therefore, since it's stuck together, now you're removing it, you have a problem of a potential malacha. So what's suggested, if you know you're going to need a Band-Aid on Shabbos, take off the tab and put it back. Ramesh's matir, there are poskim that prohibit it, and this used to be a big issue with diapers. The diapers used to have a sticky tab that you would take off and then stick back on. Now it's almost all Velcro. Velcro is like a zipper. It's not really a problem in that regard, and therefore you don't have this issue. But with bandages or Band-Aids, you do potentially have that problem. Ideally, if you can, you should do it with a shinui because of this concern. But definitely there are poskim that permit just peeling off the bandage. But if you want to be cautious, you can take it off with a shinui, so you're not doing a direct aspect of separating the tab from the bandage. Another thing about a bandage is that when you wrap it on, let's say you wrap it on your finger or on a smaller area, if you wrap the bandage onto itself, then there is a kosher aspect because it's stuck to the Band-Aid, especially if often you don't undo the bandage attachment, but you actually just pull it off like a ring and throw it in the garbage. And if that's the case, then you have created a attachment from bandage to bandage on itself and never taking it off. So ideally, one should do it in a helix, where you go and you attach the bandage only from skin to skin, but the bandage is not attached to itself. And that way you avoid problems with the bandage being attached to itself, which may be a problem of a malacha of shira. By the way, in our sefer that you may have seen, called Halachas of Refuah, we have an appendix on wound management that talks a lot about many of the things we discussed tonight. And actually, more recently, we have another sefer. It doesn't talk about wounds, but the halachas of hospital and recovery. And these are geared towards patients more than for physicians, but they discuss all about the halachas of what happens when you're in the hospital, what to do when you're in the hospital, how to deal with issues of both, everything from candle lighting to being discharged on Shabbos to carrying medical devices to fast days, there's a whole chapter on fast days and who should fast, when you have to fast, as well as non-kosher medications and things like that. But it's really a pleasure to discuss these topics. If there are any questions, I'm happy to address them. If there are no further questions, I want to wish everybody a meaningful Tisha B'Av. Hopefully, it'll be a time that we will not hear anything tragic in our midst with threat of Iran wanting to retaliate. And Hashem should continue to protect us as he always does. And we should hear Torah's Tovos and have a true Yeshua b'meher v'yameinu.
Thank you so much
All
for your
the
time,
best,
Doctor.
everyone.
That was a fascinating and excellent presentation. And yeah, easy fast to everyone. And have a good night. Thank you for listening.